Hello, and welcome to the vlogging pod. As the government shutdown continues, Republican leadership has made it very clear where they're placing the blame. Even through official government phone lines and agency website, messages have gone out claiming that Democrats are responsible and that the head of the administration, as they put it, cares about the American people. But what's being left out is that using taxpayer funded platforms to promote partisan blame is not only unethical, it may violate the Hatch Act, a law meant to prevent the use of government offices for political propaganda. So while agencies point fingers, the truth behind this shutdown has little to do with Democrats and everything to do with insurance, affordability, and control. The fight centers around Affordable Care Act, which Republicans still prefer to call Obamacare. They claim the shutdown is necessary to stop federal funds from going to undocumented immigrants, even though that claim has been debunked repeatedly. Under current law, undocumented immigrants cannot receive ACA or Medicaid coverage. Not now, not ever, except for extremely limited emergency medical care. In fact, the actual number of immigrants who might receive help through any federal insurance system is statistically insignificant, less than 0.1% or about 0.08% of total enrollees. That hasn't changed since the law's inception. So, what really is at stake? The answer is much simpler and far more personal. If the Republican plan moves forward with the Senate, returns to session, millions of Americans could see their health insurance premiums skyrocket. Enhanced premium tax credits that have kept monthly costs manageable for working and middle class families are set to expire. Without them, those same families could see their bills jump by 75% or more, with some states facing double or triple digit increases. The proposed legislation package under the name like Big Beautiful Bill Act would also scale back marketplace subsidies and raise deductibles, especially for older Americans, many of whom could pay $1,000 or more per year just to keep their current plan. Even if the shutdown ends, the damage lingers. Insurances have already filed for next year's rate hikes, with median increases around 15%. And that's before any policy change is finalized. If federal subsidies vanish or cost sharing protections are rolled back, every insurance market in the country, private, public, or employer based, will feel the ripple. When fewer people can afford coverage, healthier enrollees tend to drop out, leaving sicker and more expensive patients in the system. That imbalance, known as death spiral, pushes premiums up even further for everyone left behind. So when officials say this shutdown is about protecting Americans from paying the illegal insurances, that's not only false, it's cover. It hides a plan that could make nearly every working family pay more for basic health care while dismantling one of the few systems that actually helps lower costs. And when those same officials use government channels to point blame, they're not just spinning politics, they're breaking very laws meant to keep our institutions neutral. All while the people footing the bill are the ones about to lose the most. Today's sources come from How Will the 2025 Budget Reconciliation Affect ACA, Medicaid, and Uninsured Rate from KFF. Older adults with ACA coverage would face steep premium hikes under House Republicans' One Big Beautiful Bill Act from the Center for American Progress. Proposed ACA marketplace rule would raise health care costs for millions from the Center of Budget and Policy Priorities. Does agency messaging blame Democrats for the shutdown violate the Hatch Act from governor to executive? Fact checking on Medicaid coverage for immigrants, government shutdown edition from Georgetown University Center for Children and Families. Thank you for listening. Until next time, bye bye for now.